Most mainstream PMOS conversations focus heavily on insulin resistance, cortisol, and pelvic health, but they miss the oral cavity entirely. Can you break down the mouth to body connection for our community? And how does chronic oral inflammation or periodontal disease act as a silent driver of systemic metabolic dysfunction?
They been cramping my style all week. Craving chocolate trees, checking pants, checking seeds, sipping herbal tea and fight for menstrual equity. Sheesh. Hey, I kick Cramp's ass. 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 You're now tuned in to the Kick Cramp's Ass podcast with your host, Brittany Walker, advocating for menstrual equity, period poverty, and womb wellness. New episodes on Menstruation Mondays.
Happy Menstruation Monday. Welcome to the Kick Cramp's Ass podcast, the space where we treat language as a clinical weapon and biological data as your absolute currency. I am your host, Brittany Walker. And now, family, if you tuned in all season long, you know our episode on the official PCOS to PMOS rebrand shook the community up in the best way possible. We drew a hard line in the sand and shifted the narrative away from terrifying ovarian cysts and placed it exactly where it belongs, on a manageable polyendocrine metabolism. We are actively repairing decades of medical gaslighting, one episode at a time. But today, we are adding a massive critical layer to the systemic picture that mainstream reproductive health conversations are still missing entirely: the mouth to body connection. Our guest today is a total powerhouse who works exactly at this intersection. So today we're going to be deep diving into the chronic oral inflammation and the oral microbiome act as the literal gatekeepers to your endocrine system, fueling the very inflammatory loops that the new PMOS framework is finally starting to name. Now get your notebooks out because you will definitely want to take notes for this one.
Now, before we bring on our amazing guests, let's ground ourselves as we like to kick off each episode with the I am power statement, with I representing inspiration, A representing affirmations, and M representing manifestations. And the I am power statement for today is: I am an active, adaptive force of biological authority. I reject the systemic gaslighting of isolated symptoms, reclaim my clinical vocabulary as a weapon for health equity, and consciously bridge the data gaps to command an unshakable vital baseline of structural wellness.
And we also like to give a quote of the day. And through that search, I uncovered a missing piece in the care: the powerful link between oral health, inflammation, and hormone function. I heard the same thing over and over: just lose weight, as if my body in all its complexity could be reduced to a single number. That's not healthcare. That's shame dressed up as advice. And that's from Christine Horton from the Active Action podcast episode titled Polycystic Ovary Syndrome, Navigate with Confidence with Christine Horton. Now, guys, we like to go ahead and let that great information sit in. We're going to go ahead and take a good old sip of our Cramp elixir, and we're going to cut to our first commercial break.
Tired of clunky remote recordings? Level up with Riverside FM Pro. Get studio quality audio and video, effortless editing with powerful AI tools, and seamless live streaming and collaboration. Become a pro of Riverside.fm and unlock the full potential of your content. Sign up today and make your voice heard. Visit the link in the description of this episode to discover more. Now, back to the show.
Welcome back from that commercial break. We hope that you guys enjoyed it. Now let's go ahead and talk about our guest that's coming on for today. We have Christine Horton, who is the founder of Fusion Health Coaching and the co-director of programs and advocacy for the PCOS Awareness Association. Now, Christine Horton is a women's health coach and dental hygienist with a special interest in PMOS and PCOS, and serves as an advocacy co director for the PCOS Awareness Association. As the founder of Fusion Health Coaching, she brings the medical, dental, and lifestyle pieces together for a true whole person approach to care. She lives with PCOS herself, so this work is personal as well as professional. And she's on a mission to help women feel heard and finally put the pieces together. Podcast family, please welcome Christine Horton to the show. Welcome, Christine.
Thank you so much. I'm happy to be here and have the conversation.
Absolutely. And we are so happy to have you. So let's go ahead and get right into it. Now, Christine, you lived with this condition since your teenage years and spent over 2 decades in clinical dental care before founding Fusion Health Coaching. What was the exact aha moment when you realized that treating oral health, metabolic health, and endocrine health as completely separate silos was leaving patients stuck in a cycle of medical gaslighting?
For me, it was my own personal journey. So I was diagnosed at 17 and I have lived decades with PMOS. And I kind of managed it through traditional with my physician. The standard advice kind of worked. I had a journey with infertility. We managed that somewhat, all the different things. But when I reached perimenopause, my world was tossed upside down because that time in a woman's life can be crazy without a hormone and metabolic condition, but with an underlying, it was absolute madness. And so at that time, I really was searching for my own answers. And what I found, because this oral systemic or mouth body connection that we're going to get into was becoming more relevant in dentistry, it was kind of like this perfect storm. And it gave me a lot of answers to questions that I had. And then I was like, this needs to be shared with others. Like nobody is even talking about this, knows about this, and it can make such a difference because one of the problems with PMOS is you can feel helpless. You can feel like all this is happening around you, but what can you do about it? And so through my own journey, I found many ways that I could do things about it. And so it gave me power. And I want that for other women as well.
Absolutely. And thank you for being an advocate. I know living with a uterine ailment and then helping others, that's like a savior. We look at you guys like, yay, you've actually been through it. You can help everybody out from your own personal experience. So thank you for being vulnerable and sharing your experience, but also for taking back your power and teaching others how to do the same.
Yeah, absolutely.
Absolutely. Now, our recent episode renaming PCOS to PMOS, which is polyandrotic metabolic ovarian syndrome, resonated deeply with your team because it shifts the focus away from scary ovarian cysts and pointed directly at a manageable metabolism. From your perspective as an advocate and programs and advocacy co-chair for the PCOS AA, how does adopting this new clinical vocabulary fundamentally change how a patient shows up to advocate for themselves in the exam room?
Right. Yeah, this is a fantastic question. And before I answer it, I just want to save space for some women who are having difficulties with this change. A lot of women have done a lot of advocacy work and are very connected to PCOS and the women and the work that they've done. So I always want to honor that. And that's why I have everything as PMOS/PCOS so that I can include everyone while we're in this transition phase. But what PMOS does is it gives us language that can shape how we see ourselves. It takes it from one focus being our ovaries/ a fertility issue and gives us the words to make it a whole body, lifelong condition. And so we have metabolic, we have endocrine, we have hormones. We can talk about all those things. Before that was very minimized. It wasn't in the general conversation. And so I think that has opened doors for women to have more conversations with their care providers, with each other and their journey to have bigger conversations than just Can you have kids? Do you want to have kids? When do you want to have kids? How are your ovaries?
Absolutely. Absolutely. Now, most mainstream PMOS conversations focus heavily on insulin resistance, cortisol, and pelvic health, but they miss the oral cavity entirely. Can you break down the mouth to body connection for our community? And how does chronic oral inflammation or periodontal disease act as a silent driver of systemic metabolic dysfunction?
Absolutely fantastic question. So, the mouth has never been separate from the body. We have separated it, but it has never been separated. And that's unfortunate. And in a perfect world, hopefully we can come back together because the mouth is one of the few areas that's visible of what's happening inside the body. And so it can give us kind of a window into what's happening in other places in the body. And we have fantastic data, numerous studies that are linking cardiovascular health, metabolic, diabetes, insulin resistance to the oral cavity. But even outside of that, we have gut issues that are very deeply affected. So we have all these different areas that are so connected to our oral health and what's happening in our mouth. And so it is a quick way that we can get measurement of what might be happening elsewhere in the body. We can look there and see the inflammation because it's not very easy to just hop in and look at the heart and see if there's inflammation happening in anything leading up to the heart or the actual heart, where the mouth, is very accessible and we can have a good look in there. Now, as far as how oral inflammation can act as a silent driver, it's so interesting because the gums can be quietly inflamed and never hurt. So that's one of the barriers that everybody thinks, well, my teeth are fine, my gums are fine. I don't have any problems, they don't hurt, they don't whatever. But we know statistically that most people have some level of inflammation. And so there's tests that we can do to see what that level is. And we can get into that a little further if we want to deep dive into the dental
Yes.
side of it. But what the important thing is to know that inflammation anywhere in the body does not stay in one spot. So if we have inflammation coming from the mouth or starting in the mouth, it is affecting all these other systems like our cardiovascular health, like our metabolic health. And so it can be a feeding place for all of this because inflamed gums are essentially tiny open wounds. The tissue becomes very, very thin, and the bacteria that's in the mouth can get into the bloodstream via the mouth and the inflammation in the mouth. And so there are so much bacteria in the mouth. And just like everywhere else, we need to have a healthy microbiome so that we're not missing a part that could be a big player in inflammation in general in it. As far as the insulin resistance or diabetes, from the metabolic part of it, we have insulin and our cells need the glucose to work. They feed our cells. And with metabolic issues or insulin resistance, there is a challenge. It's kind of like a sticky lock. It's not easily picking up that food for the cell. And so the cell wants more of it. And so it starts this whole cycle of dysfunction because the food is there. It's just that the cells can't access the food. And so then it wants more. So then we kind of get on this cycle of this wanting to happen. And when we have inflammation in the mouth, it makes that sticky lock even stickier. So it's even harder for those cells to get that. So does that make sense on how this can be connected between our insulin resistance or our cells having difficulties getting their glucose and the mouth having this inflammation? Because that inflammation makes the sticky lock even stickier.
Absolutely. Thank you so much for explaining that because
Mhm.
I was diagnosed with chronic illnesses when I was younger. I have since reversed those with a whole bunch of different
Mhm.
lifestyle changes. But one of the things I did have
Mhm.
type 2 diabetes, and my doctor was like, hey, it could be connected to your oral health. And I'm like, how can it be connected to my oral health? And didn't even put
Yeah.
two and two together because that was many, many moons ago. And then my
Yes.
mother was diagnosed with heart disease, and they're like, yeah, it's connected to your oral health. So I have always been curious since crossing over to, because I'm a nutritionist and chef by trade. But once I decided to cross over into health psychology and focusing more on being a healthcare professional, I was curious, is this associated with any type of uterine ailments? Because you really don't hear anybody talking about it. So that's what made you so unique to me and made you stand out to me, because I love the fact that you're incorporating how important oral health, not just for our uterine ailments or reproductive health, but for any type of diagnosis that you may have.
Correct. Yeah, absolutely. And there is so much opportunity for more research, more knowledge. We kind of have bits and pieces. We know that there's very strong data on a lot of it, but there's that much more that is yet to be researched. So that's the exciting part.
Absolutely. Now, before we move forward to our next question, do you mind highlighting some of those exams or tests that you mentioned in the question that maybe some people might want to look into or talk to their healthcare professional about?
Yeah, yeah. So from the dental perspective or from the medical, or do you want both?
We can do both. Yeah.
Okay. So, as far as the medical, you would want to look at more obviously than just your ovaries. So, you'd want to look at your A1C, your fasting insulin, your fasting glucose, and those are all for metabolic things. And then your HSCRP, which will tell you the inflammation in your and what that level is and whether it's in a normal range, high, low. Women with PMOS typically have a high inflammation rate in their body already. And they're also more prone to gum disease slash periodontitis. On the dental side of things, you want to ask, what is my periodontal status? Unfortunately, in the dental world, we still are kind of going in and saying, my dentist said everything was fine, or they say I need to brush a little more, or I need to floss. And that might be true, but those are kind words of saying that they're seeing some inflammation. If they're not seeing inflammation, they're not going to tell you that you need to do something else or something more or whatever. But what we need to happen for this, I believe, to really hit home is to have the true conversations about what is my periodontal status. So you want to know what your stage is and what your grade is. So the way that we do this is we do a periodontal exam. We take a periodontal probe and we measure 6 different spots on each tooth. And what it's measuring is where the tooth meets the gum. So a normal reading would be 0 to 3 millimeters with no bleeding. If we have, let's say, a 3 millimeter, but there's bleeding, that tells us that there's active inflammation, but that it's still in a normal range. So we can have readings 4, 5, 6, 7, 8, 9 even, but we want them between 0 and 3 millimeters everywhere in the mouth, and we want no bleeding. So those are the things that you want to know. And from there, it'll tell you whether you have oral disease, what kind of oral disease you have, like which stage you're at. So there's 4 different stages, right? So are you like at stage 1, which is less, or are you like stage 3, which is more advanced? And then we have this grading. So there's A, B, and C. And this is exciting because this is taking lifestyle factors into play, and it is coordinating with how fast this disease, how aggressive it might be, depending on what our lifestyle factors are. So for someone like you or I, that's exciting to see that lifestyle factors are being in play for where we're thinking how fast this is going to go. So some of these factors are you a smoker or vape, or do you smoke anything basically, or use any kind of nicotine? That would change your grading. Do you have a metabolic condition? Do you have diabetes? Because if you do, and we already know of this connection between the mouth and the metabolic, that is going to increase how fast this disease might progress. So right there in that dental world, we're already showing that there's this whole body connection, and that this dental disease could move faster because you have these metabolic or these whole body conditions happening, or you have some lifestyle choices that we know are known to increase the severity or maybe how fast a disease happens. Does that make sense?
Absolutely. And thank
Okay.
you so much for detailing that and outlining it. And I'll make sure that I list out those different exams and tests or labs rather in the description of this episode so it's easier for our listeners.
Absolutely.
Thank you so much for that. Now, we often use the biopsychosocial model here, where biologically, psychologically, and socially, which factors are contributing to your health outcomes. So, to look at how stress and biology feed into each other. If a patient is dealing with unmanaged insulin resistance or high systemic inflammation from PMOS, how does that manifest inside their mouth? And is it a bidirectional street where poor metabolic control worsens oral health or vice versa?
Yeah, absolutely. So 100% it's a two-way street. And that can be looked at as a positive or a negative, right? Because the positive side of it is if we can make one change in one area, we can positively influence the other. So if we have someone who comes into the dental office, for example, and they were just diagnosed with diabetes and they did not have good control of it, but maybe it's 6 months later and they come in again and they've now learned some skills, made some lifestyle changes. Often they'll ask, what was your last A1C? Because that tells us how manageable it's been in the last 3 months. We will see improvements in the mouth as well when those numbers have changed. Unfortunately, the other can be true as well, right? If they aren't able to, or if they haven't mastered those skills that they need to have that A1C in a healthier zone, even the tiniest bit of irritation in the mouth can look way more severe. So sometimes what we see is people are doing a good job at home, but the hormones can just affect the oral tissue so much. And the best example I can give of that is a woman who has been doing the same things with her teeth. She brushes twice a day, she flosses most days, maybe not every day, but most days. And she's never really had any gum issues. And all of a sudden, she decides to have a baby and she is pregnant and she will come in and her gums are on fire. And the only thing that's changed is those hormone levels. And it's like the body just gets so sensitive to any kind. So then, you really have to help this woman to really, let's make sure everything's like really, really clean. Let's make sure you kind of tidy up what you're doing at home because we can't change those hormone levels to keep the pregnancy and all those kinds of things. But that's the best example that I can show you that like in an instant, it can change. Having done the same things and just changing a hormone level changes what we're seeing in the mouth.
Thank you so much for answering that. And I didn't even think about, like you said, she relatively had good oral hygiene practices. And then now she gets pregnant. It's like, oh, yeah, you wouldn't even think that getting pregnant would cause that hormonal fluctuation to affect your oral health.
Yeah, absolutely. And it's called pregnancy gingivitis. And it is clinically known. It's a wide known thing. It's not like, oh, it happens to a tiny little bit. Like it affects many, many pregnant women.
Thank you for educating us on that. Now, in the nutrition and reproductive wellness, we talk a lot about like gut dysbiosis and affecting hormone clearance. How does the oral microbiome and oral biofilm serve as the literal gatekeeper to the rest of the digestive and metabolic tracts?
Yeah, so this is something that's so interesting. And this is another area where this oral systemic or mouth body connection is really, really connected. Because when we think about it from a biological standpoint, what is the start of the digestive tract? It's the mouth, right? When we eat food, our saliva and enzymes in our saliva, they are activated. They start breaking down the food before we even swallow it. And so when we do swallow it, then we get the gut. So if you are having issues with your gut, leaky gut syndrome, dysbiosis in the gut, you really want to have your dentist or someone look at what's happening in the mouth. Which brings us to a new, really exciting thing in dentistry. I guess I shouldn't say new. Some have been doing it for a while, but I don't think it's in every dental office. But that's saliva testing. And so what they're doing with that is they're taking swabs and they are seeing what is in your mouth, what kind of bacteria, at what level is that bacteria. Because at one time, a lot of dentistry was kill the bacteria, get rid of all the bacteria. We have way too much bacteria because there is a lot of bacteria in the mouth. But unfortunately, the easiest bacteria to kill are the good ones. So the whole philosophy has changed around that. We don't want to kill the bacteria. We want a healthy, balanced oral microbiome. So right now they are researching and coming up with ways that if we have dysbiosis in that bacteria in the mouth, how can we get it back into normal levels? What can we do to adjust? So there's some prebiotics, there's some oral biotics, there's all kinds of things that are being researched right now. And it's really exciting and fascinating science that looks really promising, not only for just your oral health, but also for your gut health, because you can be doing all the things with your gut. But if you have that bacteria in your mouth and you swallow it and, it's getting through to your whole system, you're kind of shooting yourself in the foot, right?
Right.
So I just really encourage anybody who is on a journey with gut health issues to really have somebody, dentist, a medical professional, or both, to really look at what's happening in their oral microbiome as well.
Absolutely. Now, you heard Christine, guys. If you're experiencing some of this, we need to start tapping into our healthcare professionals. Now, we know that was a great deal of information, guys. So, we're going to let that sink in for a second. We're going to cut to our next commercial break, and we will be right back with you.
Periods got you down? Kick cramps to the curb with Pilates for periods. Our online program combines targeted Pilates, soothing yoga, calming meditation, and breath work to help you manage your menstrual cycle naturally. Feel stronger, calmer, and more in control. Reclaim your comfort. Visit Pilates for Periods YouTube page, linked in the description of this episode, and start your journey to a more manageable cycle today. Now, back to the show.
Welcome back from that commercial break. We hope that you guys enjoyed it. Right now, Western medicine completely separates dental care from medical care. Even our insurance systems treat the mouth like it's not part of the human body. When a patient goes to their dentist or their endocrinologist, what are 2 to 3 specific screening questions or lab markers that should demand the bridge to this gap? You kind of mentioned some things already. So, would you
Yeah,
like?
yeah. So I'll reiterate those. Again, when you go to your endocrinologist, probably your A1C, your fasting insulin, and your HSCRP would be some of the main ones. With PMOS, you do have a higher risk of many other things. So there's, you want to look at your cholesterol panel, you want to look at your blood pressure, you want to look at your BMI, waist circumference, all of these pillars of health to get this whole picture, because any one test might not give the whole picture, but you can kind of put it together. And women with PMOS just have such higher risk of so many things: fatty liver disease, heart disease, diabetes, periodontal disease. We could just go on and on all the things that they are. And I don't want to forget any of the mental health. They have a higher risk of depression and anxiety as well. So there is a lot of things that they can screen for. There's a lot of tests. What I find is when I talk to women is a lot want to get a baseline, and then where they flag things, they want to monitor them and see that they get better. Another big one for PMOS is the androgens, or their testosterone levels. That can be a root cause of a lot of symptoms that women with PMOS see. From the dental perspective, it's that whole conversation about what is my periodontal status. Do I have inflammation in my mouth? What stage and what grade am I at? Those are just so important to know, as well as, do you have any dental needs that haven't been taken care of? I've talked very much about the gums and the gum tissue and all of that, and it is very critical. But even things like cavities are so important as well, because what a cavity is it is a hole in the strongest structure in the body. So we need to know why that's happening. And if that is not treated, it just progresses. So it gets bigger, and eventually it can get to the pulp, the meat of the tooth. And then you start getting into abscess teeth, and abscess teeth are infections. And what starts as an infection in a tooth can then become a systemic infection. And that, of course, is not what we want. So if you do have untreated cavities, they don't just stay as they are, they progress. So you need to get them taken care of. And the earlier you can do it, the better. And when you have that hole in the mouth, also, it's very hard to keep clean. So it harbors bacteria. And again, we want to be mindful of what type of bacteria we have in our mouth and at what levels. And we want to be able to manage that as well. So it'll be easier to manage if you don't have the decay.
Thank you for going in such detail with that because I don't think people understand that a cavity, let alone an abscess, is kind of like the beginning signs like, hey, something's not right. And a lot of people will get cavities and they unfortunately have normalized, oh, it's just a toothache. I'm going to take some Advil or something over the counter and keep it
Hmm.
moving. Or I drank something cold. So everything's just sensitive right now.
And it's like, no, that's your body literally giving you the warning that something is wrong and you need to get it checked out before it gets worse.
Yeah, absolutely. And that's exactly what happens. If you don't take care of it when it's a little bit, all of a sudden you'll be going to whatever and you'll wake up and you'll have the swelling because it's gone from just the tooth into, an abscess.
Absolutely. Thank you for sharing that. Now,
So.
you were diagnosed as a teenager with PCOS, an incredibly difficult stage when young individuals are just learning to navigate school, self esteem, and daily life challenges while on their periods. If we were to dismantle the taboo early, what should parents, hygienists, or even pediatricians be looking for in a young person's oral health that might hint at an underlying metabolic or hormonal shift?
Right. So, do we have bad breath? Do we have bleeding gums, red, puffy gums? Sometimes when it's first starting, it's just right where the tooth meets the gum. And if you notice those things, you just want to get them taken care of as soon as possible. Other things that you might notice is maybe they're starting to get hair in places that they don't normally get that could indicate maybe high androgens. So, maybe on the lip or under the chin that, a dental hygienist or a mom might notice and think, that seems a little different. I'm not sure what's happening there. Those are all signs of maybe trying to look a little deeper into what's happening. Another thing is if they are doing a really great job with their home care and they still have some issues, because that's kind of like a sign of a deeper thing going on. Yeah, so that would be another thing that as a hygienist I would look at if I'm like, I know they're doing this and I can see that they're doing that, but we're still seeing these other things, like what's going on. Another one would be cystic acne, like hormonal acne. And a lot of teenagers deal with acne, but this is different in that it's not surface level. It's like deep and it's painful, and it's often like the lower face that it shows up on. Those are signs of potentially that higher androgen kind of thing. So when you go see your dentist or your dental hygienist, we kind of see the whole face thing. So those are things that we look at to just see if we notice anything. But even as a parent, those would be things that maybe you'd want to take your daughter to their pediatrician or to their dentist and just ask a few more questions and advocate on their behalf, because that is a chaotic time and it's hard to know what's normal and what's not normal. But if you notice something, the sooner that you can ask questions to professionals, the easier it often is to find answers.
Absolutely. And thank you for giving the other markers to pay attention to because most people say, well, I can't have PCOS or PMOS because I don't get facial hair or, I don't have this or I don't have that, but then I have horrible cycles and they can name all these other things that are associated with metabolism. I'm like, you might still have it. You need to go get tested just because your body might not have the acne. You might have symptoms in other areas that you're just not cognizant of. A lot of clients that I've had feel that they didn't have PCOS because they didn't have the lower facial hair growing in. And I'm like, that's just one symptom. Your body is not going to do exactly what another menstruator's body is going to do. So thank you for highlighting.
Absolutely. Yes, 1,000% I agree with you. And that's the challenge in diagnosis often. Medically, you need 2 out of the 3 criteria. So it leaves a lot of room for variance between. So we can have 5 women and we can all present physically differently, as well as emotionally, as well as metabolically, right? So insulin resistant is a major driver, and it statistically is in 70 to 80% of women with PMOS. But there's still that 20 to 30% that don't have any of those markers, but then they have other ones. So that's what does make it challenging, because you're like, even if your mom has it, let's say, for example, and you notice this, this, and this, you might not have those same symptoms. So it's really critical to have a great healthcare professional that is aware of what that criteria is and how to test for it. There's lots of different things out there that you can look at that are kind of, they don't diagnose you, but they're kind of red flags. Like, at what age did you get your period? A lot of women with PMOS got it really early or really late. So, if you were really early or really late, that might just be one thing. Doesn't mean you have it, but it's kind of like this is common to what a lot of women who do have it. This is one of the things that they first noticed, if that makes sense.
Yes, absolutely. Absolutely. It also made me think about colleagues or schoolmates or people that I went, K through 12 now that have these different uterine ailments. And I look back and I'm like, yeah, because I remember that you had, chin hair growing, or I remember that you couldn't figure out why your lower belly would swell up when you ate certain foods, but some of us can just eat, eat, eat and go. Like, it's just paying attention to the different signs over the years, or like how you even mentioned about the bad breath, knowing people that had like stale breath at an early age and we
Mhm.
didn't know why. And then I find out, 20, 30 years later that they have fibroids or PCOS. And I'm like, wow, could that have been a marker that was being shown at an early age? But we as kids were not paying attention to it. And maybe your parents may not have been educated or not known what markers to pay attention to as well.
Mhm. Mhm. Absolutely.
Yes. So at Fusion Health Coaching, you focus on treating the whole person rather just managing independent symptoms. How do you integrate daily lifestyle habits like somatic stress management, nutrition, and nervous system downregulation to lower oral inflammatory markers and insulin spikes simultaneously?
Yeah. So the way I work with clients one on one is we do a whole inventory of their whole lifestyle. We have different pillars and we build all those things into it. Because what happens is you have to have some level of mastery on multiple things. You can't out nutrition a lack of exercise. You can't out exercise really poor nutrition, right? So you have to have some level. You don't have to be 100% on all of them, but you have to have some level of efficiency in all these areas. So the first thing we need to know is, where are you at in all of these areas? And what is your pain points right now? Like, what is affecting your life in a negative way that you want to start making some changes? In this day and age, stress management, sleeping, all of those kinds of things. If you were sleeping 2 hours a night, there is no way to start working on a million other things until we can start implementing some of that, because the body needs rest. No matter how much you can get done, no matter, how big your job is, no matter how many people need you, you still need to rest your body in and give it the time to rejuvenate and set its cycles and do all these things. So that's how I work with women. It's very individualized. It's very, what do they need and what do they want to work at, knowing that we need to get to a specific level in multiple different areas for them to feel well and have management of their symptoms. Because with PMOS, there is a lot of different symptoms, and it can feel for a lot of women like it's taking over their life and they just don't know what to do about it. They'll go to social media. A lot of it is very quick fix type things. And I wish it was as simple as that. It is not. It is a lifelong condition, but you can manage it. And when you manage it, it becomes a piece of your story. It's not the center of your everyday life. And that's really what's important, to let's get it to that point.
Yes, absolutely. Amazing health coaching advice. I love it. Now, as a fellow of both the American Academy for Oral and Systemic Health, which is the AAOSH, and the American Dental Hygienists Association, which is the ADHA, you straddle the worlds of clinical science and holistic coaching. Now, how do you advise patients to handle a medical provider who dismisses the link between their oral inflammation and their hormonal metabolic symptoms as pseudoscience or unrelated?
Yeah, absolutely. Fantastic question. This isn't about having an argument with a provider. Ultimately, you get to pick who your providers are, and you want to have a connection with them that you feel like you can build the best health for you. So, whether that's a dentist, a doctor, a coach, anybody that's on your team, you need to realize that this is a marathon and not a sprint. And so you want somebody who's similar, but also I do very much respect there are phenomenal, great professionals that have 40 years of experience, that this is something new and what they know is very, very relevant. I find a lot are open to learning more, or they want to find out, like, what is the actual science behind it. And so one place that is very good for those science minds is AOSH. That is the association where we're bringing together the medical and the dental people together. And we want everybody to bring their expertise, and let's come together so we can get it out there for the general public. So that is a great place to find some education. And it does have the studies and all the research and the science that they're probably looking for, rather than just us as a patient coming in and being like, I heard this and I want that. So that is a good reference that you could send them if they wanted to learn more about it. But ultimately, you get to choose who you work with for your care. And so you need to feel comfortable with what your beliefs are, whether they're willing to help you, and look at this as a whole body. A lot is moving towards that. Our system is not set up very well for it. Because doctors are phenomenal at their jobs, but they are pushed from every which side. They have very limited time. They have so much knowledge, but their knowledge is, what are your issues? What can we rule out? What tests do we need? And what are the results of those tests? And what's the treatment plan going forward? Unfortunately, in their 15-minute appointment, they do not have time to get into, let's say, how to make lifestyle changes that are going to serve long term. Because if it was as simple as someone saying you need to eat better and you just went home and miraculously ate better, that would work. But it doesn't, because it's like, well, what does that mean? Because this is how I've always eaten. I thought I was eating well, right? So it opens the door for a lot of conversations, but your doctor probably isn't the one that's going to be able to do that on a weekly basis and that kind of stuff. So that's where dietitian, health coaching, those type of professionals come into play to help you work through and learn those things that maybe you're not aware of. And that's one piece of it. But then the second piece is how do I put that in my life? Because we are all busy, right? We have jobs, we have kids, we have aging parents, we have significant others. Like, we're busy. So it doesn't do any good for anybody to get a perfect plan that they can't implement in their everyday life. Because otherwise it just gets started and never finished, or they do it for, a short amount of time. But what we're talking about is sustainable long-term habits to make these changes, because regardless of who your medical or dental professionals are, whether you use medication, whether you use supplements, lifestyle changes are the foundation for everything. They make medications work better. They make supplements work better, are in your control. So you can decide how you want to tweak that. So you really want to use those lifestyle changes in addition to those other things you might need, or you might not need, or you might need for a period and then you get to a point where you no longer need them, which is often the case with women or men that are diagnosed with type 2 diabetes, right? Maybe they're able to make some lifestyle changes and now they're back in a healthy blood sugar range, which is amazing. But yeah, that's my whole take on working with professionals that maybe might not 100% understand about this mouth body connection, but choose your team and know that you have power regardless of who's the members of your team.
Absolutely. That was amazing and valuable information. And I'm also going to include the link of the website you mentioned for our listeners to go and get more educated as well for themselves. I believe that was the American Academy for Oral and Systemic Health you mentioned.
Correct. Yes.
Yep,
Yes.
I'll definitely drop that link in the description of this episode for our listeners. Now, if
Fantastic.
you could paint a picture of a truly inclusive, modern, and adaptive healthcare system, one that honors the mouth body connection and treats endocrine health as a systemic vital sign, what does that look like for the future generation of patients?
Yeah. In my vision, medical and dental are one. We have one record and everything is in there. So when you go see your cardiologist, they can see if you have inflammation markers from the mouth, or they can see that you did and now you have them under control. So we're good there, because what we want ultimately is for everybody to be able to talk to everyone and share all of our knowledge. So you get the benefit from everybody's knowledge. And to be able to access records, it would make it so the patient or client doesn't have to try to explain what they heard from somebody else. And it would be there in plain black and white, right? But until we get there, I think referrals are really, really important, that we're doing it between our medical and dental. Things like doctors asking, when was your last dental appointment? What is your periodontal status? Do you have any untreated dental work that was recommended to you? Because those are all clues that give them signs that there's things that could be playing a part in that dental part. As far as the dentist, I would love for them to be asking, which some already do, what was your last A1C if you have metabolic issues, do their blood pressure screening, which a lot of dentist offices are doing. And again, if we shared records, we would not only have our once a year to the doctor, we'd have twice to the dentist. So we'd have a lot more data to look at, and they could make clinical judgments on what might need to be done or not done. So in a perfect world, that's what I would see. Medical and dental insurance as one, and one central place for notes so that everybody can extract what they need that's relevant to what they're trying to help their patient or client with.
That's amazing. I actually love that idea because that would simplify things so much. So,
Yeah.
thank you for all of this valuable information, Christine. We're actually going to cut to our final commercial break, and we will be right back with you guys.
Do you want fly? Do you want to fly? Let go of all the things that hold you down. Used to be so easy.
Now, back to the show.
Welcome back from our last commercial break. We hope that you enjoyed it. Now, Christine, can you let the listeners know how to reach you, your website, or your social media platforms? Also, if you have any upcoming events or initiatives that you would like to let us know.
Sure, absolutely. So for me personally, you can find me at Fusion Health Coach. The fusion part is the medical, dental, and lifestyle to help you remember. So my website is www.fusionhealthcoach.com. On social media, I am everywhere. YouTube, Instagram, Threads, Pinterest, you name it, I'm there. And everywhere, it's PMMOS. PCOS Glow Hygienist. You will find me. I would love to connect with you. If you have any questions, my email's always open. My DMs are open. I would love to have a conversation and see how I might be of service to you. As far as my role with the PCOS Awareness Association, we have a couple of great things coming up that I would want everyone to know about. I co-run support group. It's the second Wednesday of every month and it's virtual. The sign up is on their website, which is pcosaa.org. As well, there's fantastic scientifically proven knowledge on that website. Everything has been run through a medical team. So it is legit information about questions that you might have about PMOS or PCOS. As well, we have a virtual event coming up in September because that is PMOS Awareness Month. And we have PCOS Con coming up on September 26th, which is a day of all the greatest speakers from all over coming and adding their bit of expertise to bring it into this one fabulous day. It'll be virtual and you can get tickets at pcoscon.org. And yeah, we would love to just see people there, because the one thing with the women I work with is they feel very alone with PMOS. They don't think there's others out there that are dealing with the same thing, which they are there. You just need to find us. Statistically, 1 in 8 women have it, but 70% are undiagnosed. So ask the questions, get the testing, and come find us. You can find me at my website, social media, PCOS Awareness Association. We're there as well. And the support groups are fantastic as well. So we would love to see some of our other sisters there and provide some.
Absolutely, guys. And I will include all of that information in the description of this episode. Now, on our end, August is National Wellness Month, so we encourage you to proactively manage your wellness mentally, emotionally, spiritually, and physically in an effort to achieve optimal wellness. I will include an episode surrounding these wellness components that we have from a past season for you to use as a refresher for resources and tools. PMOS month, as Christine mentioned, is next month, so we will be providing more educational content on how to manage the metabolic factors that impact your menstrual cycle. September is also National Yoga Month. So, we are a registered yoga teacher and Pilates teacher, and we have Pilates for Periods, which is our mindfulness and movement program where we offer yoga, Pilates, breathwork, and meditation. So, we will have a whole line of content to highlight the month of September. And then on September 18th, we will be instructing a course for the Clinician Fest. I'll be teaching a course on how the biopsychosocial model impacts both your mental health and menstrual cycle journey. Registration for this event and everything mentioned above will also be included in the description of this episode. So let's recap. Wow, family. Let's just take a collective deep somatic breath together after that one. If you have been treating your oral health as just a cosmetic routine or something completely separate from your hormones, today's conversation with Christine Horton was your wake-up call. Using our foundational biopsychosocial model, Christine beautifully mapped out the exact bi-directional street connecting your mouth and your metabolism. We learned today that your chronic oral inflammation isn't just an isolated issue. It introduces systemic cytokines into your bloodstream that directly impair your insulin receptor sensitivity, making PMOS symptoms that much harder to manage. The mouth truly is the gatekeeper to your cellular health. Remember what Christine said, your body cannot be reduced to a single number or an isolated symptom, and being told to just lose weight without looking at the physiological roots of chronic inflammation is shame dressed up as advice. It's time to reclaim our biological authority, drop the euphemisms, and start asking our healthcare teams the hard clinical questions to bridge the gap between dental and medical care. Now, before you move into the rest of your week, take care of your nervous system. We have low impact somatic movement sequences, meditation, and breathwork options specifically curated to help downregulate your nervous system and lower systemic inflammatory spikes on our Pilates for Periods YouTube page. Now, if this episode upgraded your health literacy, if it validated your lived experience, and if it handed you the clinical tools you need to advocate for your own menstrual cycle, do not keep this space a secret. Hit that subscribe button right now. Leave a 5-star like or review on whatever platform you're streaming us on. If you're watching the video, we're on Spotify and YouTube. Or if you're listening, you could do Spotify, YouTube as well. But we also have Apple Podcasts, iHeartRadio, Amazon Music, and so much more. And feel free to share with someone who you feel can resonate with this episode or either Christine or I's missions. Also, subscribe to our Pilates for Periods YouTube channel, join our newsletter, and stay deeply connected to all the resources, evidence-based tips, and structural health education we drop every single week. This information is located also in the description of this episode. Now, if you have any questions or concerns, we are still accepting listeners' mail. Feel free to comment on this episode, or if you want a more intimate or personal interaction, email us at contact@kickcrampsass.org, which is also listed in this episode's description. Now head over to fusionhealthcoach.com to check out Christine's incredible work and follow us on YouTube, Spotify, Substack, Instagram, and Threads, even LinkedIn, to whichever platform you are hearing this podcast on, and at Kick Cramps Ass on all those social media platforms, just to join the community conversation. Now, gratitude to all of you for tuning in today. We want to thank Christine for coming on and educating all of us, leaving us with some special gems to adequately manage our PMOS and our oral health. We manifest a positive, productive, and peaceful remainder of the day, the week, and your menstrual journey ahead. And we'll be speaking to you during our next episode on next Menstruation Monday. Peace.